We have two presenters here today, Adrian Rodriguez and Sheila Weaver from Idaho, who will be sharing some of their journey as they expanded their outreach to Hispanic populations in Idaho. And we're going to let them share their slides. We'll turn the time over to them.
All righty, thank you so much. Let me just get this screen sharing set up, and we'll get going here. 1 second. Okay, share. All right, hopefully everybody should be able to see our slides now. Can you see them? All right,
great,
perfect. Thank you so much. My name is Adrian Rodriguez. Thank you for having us here. We're so excited about kind of sharing our experience as far as outreach to the Hispanic populations and how that came about within our strategic plan and the activities that we participated in to do that. And just as we're kind of going along about this, maybe thinking about your own organizations, maybe what you've already done, or if any of these examples resonate with you, or kind of give you ideas for activities that you can implement that are similar to this. I am a health educator and family caregiver navigator on one of the programs that we have here at Boise State. It's called the Family Caregiver Navigator program, which is where a lot of these activities are being implemented. Also part of the Idaho Caregiver Alliance, which is just that, right? An alliance of organizations, agencies who are focused on supporting unpaid caregivers across the lifespan. And I'm joined today with our program manager, Sheila Weaver. And so, yeah, just I'll go ahead and get started. I want to be mindful of time here. So really kind of how this became integrated into our strategic plan was just kind of this ripple effect where in 2016, we really didn't have anything in our strategic plan regarding Spanish speakers. It wasn't until a few years later, actually, we were having one of our quarterly Idaho Caregiver Alliance meetings, and one of our stakeholders who was with the state agency said, hey, you know, we're not actually, we notice we don't receive any complaints from the Spanish-speaking community. And somebody else from another agency piped up and said and asked, well, wait, do you have that form available in Spanish? So just kind of something as simple as that caused us within the Idaho Caregiver Alliance to really reflect back and evaluate our strategic plan and look at our own program and see, oh, how are we being mindful about engaging the Hispanic community and what activities are we engaging in? And so that was really the impetus for that to be included in our strategic plan. Not letting me advance. What? Here we go. So in 2020, that's when we really began to incorporate and make that effort by including our goal. So our third goal in our strategic plan is to ensure accessible and culturally appropriate. It's moving everybody's faces over here. It's covering my screen. Just to ensure accessible and culturally appropriate information and resources that are available to caregivers across a lifespan. But how did we do that? I want to emphasize that we did it slowly and through several activities. We didn't do it just all at once. And so we're going to go through a bunch of those. And again, just kind of keep in mind, you know, maybe how your organization can do the same, or if you've already done some of these activities, it'd be interesting to learn about what you guys are doing as well. So one of the first things that we did is, okay, we need an advisory committee, right? So we have a couple advisory committees, and so we formed the Hispanic Advisory Committee, and we really wanted this to be centered around partners, caregivers, and members of the Spanish-speaking community. And so this includes representatives from nonprofit organizations, state and local government, our area agency on aging, our agencies. We have several, and then healthcare organizations and other organizations and agencies. And then from there, what we were able to do, thanks to a lot of those relationships that we had, is we were able to receive funding to diversify our staff, right? So we hired on, these are some of our navigators who have come and worked in our program that are Spanish speaking and are representative of that community. And so this has helped in tremendous ways. Just in one aspect, it's given us more of that representation, and it's also helped us develop more activities to include in our strategic plan, and it's helped us really start building relationships with a lot of organizations. Another activity that we participate in is previously we thought our program was available and accessible, but it was really just available, right? So we really wanted to make it also accessible. And so part of that is making sure that our complaint forms are in Spanish. No, just kidding. But making sure that all of our material forms are available in Spanish. And so really being mindful about everything that we have available in English, that we are translating that into Spanish, and not just doing direct English to Spanish translations, but making sure that it is culturally relevant. And I'll go give you some examples of that here in a minute. But just kind of wanted to share with you what our marketing materials look like. So these are kind of like some postcards and some pamphlets that we take with us as we are out there and engaging the community. Maybe we're doing outreach or tabling an event. We also have a video here that goes over our Family Caregiver Navigator program. So we made sure that we translated that in Spanish. So again, these are the materials that we're taking with us out into the community. And also we have a form on our website where any organization or really any of our partners or anybody in the community that we can really connect with, that we try to connect with everybody, or they can order these, and so they might have them in their doctor's offices, or like if they're offering counseling services, and whatnot, they have those on hand if they're interacting with caregivers. So making those available. And then another lesson that we've learned is, just kind of where does the Hispanic community receive a lot of their information? And as far as social media, well, we have an online social media presence in English, but we would need to make sure that we also have that available in Spanish, right? And so Facebook is kind of one of the main sources of information for our local Hispanic community here. From what we've gathered from them, some of the knowledge that they shared with us. And so we've been intentional in having a separate Facebook for our program that's available in Spanish. And this helps out in a lot of different ways. One, we're able to share information about our program, things that we are doing, events that are coming up, able to share it in Spanish. Two, it allows us to really build and maintain those relationships with other organizations, Hispanic organizations, those that are pillars within the Hispanic communities that are respected in the Hispanic community. And so we share their posts, and they return the favor as well and share what we're doing as well. So here's some examples of those posts there. There's the Mexican consulate that we were at. There I am, if you can pick me out there. And then also being, what's a lesson that we've really learned is the importance of having that face-to-face. So being physically present, which is more so needed in the Hispanic communities that we engage with, that face-to-face connection. So not just having the materials and the online accessibility in Spanish, but really going out into the community and meeting the community where they're at. And this also helps with maintaining partnerships and building those connections. So we like to partner with a lot of our members from the Idaho Caregiver Alliance as well. So here on the top right, we are partnering with one of our local hospitals who's a part of that advisory committee. They have an outreach program for the Hispanic community. They invited us to come to the Mexican consulate. We're fortunate to have a Mexican consulate here in Idaho, in in Boise, specifically where we are, I recognize that not every state has this, but maybe you have one locally or a regional one that you can engage in, or you maybe one of the organizations that you partner with has a relationship built with them. Can you maybe partner with them and do outreach there, which is what we're doing here. And again, on the top left here is at the Mexican consulate as well, the mobile Mexican consulate. They move about to the rural parts of the community, and you may recognize this organization here, the Alzheimer's Association. So we partnered with them. We're doing kind of this mobile outreach with the Mexican consulate, and just some other examples here. These bottom images are us as a vendor and tabling events, and also giving presentations through some of the partnerships, the outreach that we've done, and the relationships that we've built with local Hispanic organizations. We've had the opportunity to be a part of their annual conferences. I don't know if anybody is familiar with BAPH. It's a national organization. BAPH is focused on social justice and issues important within the Hispanic community, and their local chapter here, the BAPH of Idaho, is that's their annual conference. So really proud of us being able to participate in that. And then another activity that we engage in is making sure that our presentation, so when we are out presenting about our program, so the Family Caregiver Navigator program, making sure that we're being inclusive of the Hispanic community in that presentation. So just kind of going to give you just some examples of the slides that we have in the presentation as we're going out there in the community. And so here's a slide that just showcases our website, that it's available in Spanish for that program. And then just making sure that our slides and our materials are representative of the Hispanic community. So giving that representation, and also showing or educating on what are the unique experiences that caregivers are experiencing. So if we were to give this presentation to, well, we have to like a hospital, or recently we did it to local paramedics here that may be engaging with Hispanics and Hispanic caregivers. What are they experiencing? Another slide that we have in our presentation, and I like this one because we have also learned that we can't just silo Hispanic caregivers, right? We want to recognize the intersectionality. You know, we may have Hispanic millennial caregivers. I'm sure we know that caregivers are typically a younger age than we tend to think of what they are. So that millennial group is really a big, a large part of the informal caregivers that we interact with. Immigrants, what are they experiencing? Or LGBTQIA plus caregivers who may also be Hispanic. So being mindful of that. And then also really put some other slides from our presentation. These are kind of personas that we've developed, caregiver personas, being mindful about putting a face on what Spanish caregivers look like, and that these personas are also culturally relevant. So really quickly, as an example, Karina here, her parents are immigrants, and so she is a first-generation college student with a brother who has disabilities. And so she has to go with her parents to kind of work as a translator. And then she has her school responsibilities. And then she's also a caregiver for her brother. And so just that intersectionality and making it culturally relevant, we experience or work with caregivers that have similar experiences. And then something that I'm really, really proud of, that again, this didn't all happen at once, just from 2016 over time, just kind of building these in, these activities in. But something that I'm really proud of here is our annual caregiver conference. Through the partnerships and relationships that we've developed, we've been able to receive funding to develop a separate conference that's specifically in Spanish for the Spanish-speaking community. And so in 2023, we had our first hybrid platform where it was available online and in person. Again, a lesson that we've learned is that in-person connection is crucial within the Hispanic community, and also meeting them where they're at. So we were intentional about having this where the Hispanic community is. And so we held this at their Hispanic Cultural Center, which is a trusted, respected pillar in the Hispanic community. Really important to recognize that. And then another outcome that has come with a lot of these activities and the relationships that we've made. I'd encourage you guys to scan this QR code. Is we've been able to receive funding to participate in research regarding Hispanic caregivers and Hispanic communities in general. And so just want to kind of share a lot of the highlights on there from that research that we've want to be mindful about as we're engaging the community and as we're continue to develop and improve our programs. And so one of the key lessons that we've learned from that is the influences what are the influences of service utilization among Hispanics when it comes to our program or healthcare systems or public health, social services, things like that. Surprise to nobody, unique barriers influence service utilization, but something really interesting that we are really mindful of now are the strong cultural values that I really want to briefly go over. Familism, personalism, they're that strong interconnectedness and interdependence that Hispanics have within their community and within their family. This tells us in our caregiver role or a public service role that trust is big. It's you have to really develop trust to kind of break into these networks, and also that we're not just engaging the individual, right? The individual caregiver. We're engaging the family unit, right? It's usually like a what is it? It takes a tribe to raise or a village to raise a child, is kind of what I'm thinking of there. Kind of really similar within the Hispanic community. It's a family unit that's being engaged in these activities. Also, Marianism or machoism. These are the gender roles that are taken on between male and female Hispanics that also have a play in service utilization, how Hispanics engage in services and engage in caregiving. So Marianism is a female role derived from the Virgin Mary. It includes qualities of selflessness, devotion, patience, sacrifice. So what does this tell us when we're wanting to work with caregivers? Well, it may tell us why they may not be engaging with us, right? Maybe going to seek our assistance at the Family Caregiver Navigator program or some of your services may go against this value because asking for help, well, no, this is part of their devotion, right? The traditional male role of machoism, where the males are seen as kind of the protector of the family unit, the household, maybe coming and asking help from our services may be a sign of weakness and go against this value. So respect, again, I know we've touched on this a little bit, but respect is crucial within the Hispanic community. It takes time to build. We've learned this, and we just have to be patient and continue to build these relationships and to be present within the community and let them know, hey, we're here, yeah, or we're gonna continue to be here. And dignidad, this was a very interesting one that we've learned. And it has been a part of a lot of the evidence-based evaluations that we recently developed. So dignity, the strong need to be treated with dignity. This means that institutionalized care can be seen as taking away from that from a person's dignity. The word respite may be seen to go against this value. Respite services may take away from an individual's dignity. Also, even just discussing or talking about a disability or a disease, Alzheimer's disease or an illness could be seen by this cultural value as taken from that person's dignity. So this can result in late diagnosis or maybe no diagnosis if we're not talking about it, right? And then just really quickly, some of the barriers, I just want to really highlight the language. So not just directly translating from English to Spanish, but is it culturally relevant? If we look back at these cultural values, we realize that, Marianism, the words, a lot of the language that we use in caregiving in our caregiving world, like burden or respite, we can't use those within the Hispanic community because it goes against that value. It's not a burden, it's our selfless duty, it's our devotion, right? Also, legal status is a big one. I just want to point that one out as well. Why are they not engaging with us? Well, is the legal status a play, maybe a factor at play? It is. And so just recognizing that, we have to be mindful of that. And when we're discussing our programs and services, letting them know, we don't ask you what your legal status is, we don't share your information. And then also what we've discussed a little bit already, just the lack of culturally competent resources and materials going back to 2016 when we didn't really have any of this really. And so beginning slowly to kind of make our program and our materials culturally competent and available, accessible within the Hispanic community. And then just really quickly, more of this in detail in that report. I definitely encourage you to look that over. But just something I want to point out again is that cultural literacy. So just not just translating directly from English to Spanish. And then also we recognize that there was a point where we didn't have the resources to diversify our staff, to hire on Spanish speaking navigators or staff. And we've interacted with organizations who are unable to do that. And so what are they doing? Just making sure that they have interpreters available. Maybe they're able to partner with other organizations that can share their resources in regard to interpretation. And a big one here, again, that going back into the community is community-based participatory research. So when we're going into the community, we're not going in there with our agenda and saying, oh, this is what we think you need. No, it's asking the community, what are your needs? What are your barriers? What are your experiences? And then taking that back with us and integrating that into our program and our services and our strategic plan. And then from here, I'm going to hand it over to Sheila.
Yeah, definitely. And one thing I really want to bring up here, something we've been really intentional about, is we've made these little steps along the way. But some of these little steps have really added up, and we've gotten some nice recognition out of this. So we've really wanted to celebrate our successes and just let people know what we're doing in the Spanish-speaking community. So for example, Adrian did some research with Dr. Nihar and Sarah Taves. Dr. Nihar is there on the right, and entered this in a local university competition for a 3-minute thesis as a surprise to nobody here. He got #1 at the university, #1 in the state, and #2 regionally, and is going to nationals in Washington, D.C. In December. And so we've just seen that nice success coming out of that. And then with that kind of like recognition and having just that availability, we've been able to present at conferences and really get the word out and just talk to people like you that really care deeply about this issue, but are just trying to figure out where to start. So I don't think Adrian would promote this, but if you'd like to, the little link is there. Welcome to watch Adrian's little 3-minute thesis. It's pretty cool, and it's really only 3 minutes. But with that, I'll go on to the next slide. And also too, I just want to reiterate, 2016, we started with nothing in the strategic plan. It just started as a conversation. It was just one very intuitive person going, well, do you have the form in Spanish? How do they complain? And it turned into something that was really, pretty remarkable, in my opinion. I'm really have been proud to be part of this work. And so just a little rundown, we kind of recognize those gaps. We formed the Hispanic Advisory Committee, started rolling out, staff, materials, research, just doing everything we could. And then that annual Spanish-speaking caregiver conference, we are hoping to bring that back we are looking to bring that back this year. It was pretty cool last year. And then just that continued program evaluation to really figure out if what we're doing is impactful. And some of the lessons that we've learned, I just want to be really clear. I'm just I'm not a person of the Hispanic community. And so I think it was incredibly intimidating for somebody like me to come in and just go, oh my gosh, how do I do this? In a state where between 13 and 14% of our population is Spanish speaking. They're the largest minority in the state. And so I just want to reiterate, those small steps are really meaningful. A lot of the time, it is table by table, it is meeting by meeting, it is one concern phone call, you know, it is those kind of it's just those kind of conversations that have built our success. And just that trust and rapport building, we really had to find our way to be ourselves, really kind of build into the community. I remember a gentleman told me, gosh, quite some time ago, he goes, we don't really think about relationships like in periods of like months. We think of relationships as in generations, you know? So just how do we start building that now? Really just engaging with those social networks and organizations as part of that community resource. I mean, research. We don't want to come in as the Idaho Caregiver Alliance and go, hey, we're here to save you. We've got this great plan, you know, we want to like show up and figure out what's already in our community. And I would be willing to bet if you just like, if you're sitting in Chicago right now or Washington State and you Google Spanish speaking organization, Washington, you find something or wherever you're at. Spanish speakers are in every community. Again, that cultural sensitivity piece, just really thinking about how we integrate those cultural values, thinking about like what saying caregiving really means in a Spanish speaking community. It's interesting when we talk about like, you know, like, well, would you think about putting your person you're caring for in a nursing home? And the words almost don't translate. It causes confusion. So we have to be really careful with that. And just being aware of barriers. I think Adrian did a nice job talking about that today. And I really want to kind of just spend a second on the sharing and transferring of power. So we had that, go ahead and flash. These are our people that are support us here. We did the Spanish speaking conference last year and we did it on a shoestring. And so we've been looking at how to do it again this year. And it's been fascinating because one of the lead organizations, kind of a Spanish speaking women's organization, has really kind of come back to us and said, well, how about we take that and you help us? You know, kind of in short, you know, not, but, you know, and so we were kind of thinking about, okay, when we do this right, other people want to take it on and be a part of it. And so it's been really neat. It's been pretty special to watch this little conversation just turn into something that's really benefiting our Spanish speaking community and giving us a lot of learning along the way. So at the end of the day, you know, it is a process, you know, even if it's just, you know, as our website in Spanish, does someone know how to can a Spanish speaker complain to us, even tell us what we need to do? Maybe not. And I might just be starting there. But again, I don't get to sit in on Art July. I probably should more. So I've really appreciated all the conversations and just the caring that you're doing today about caregivers in the community. It really does mean a lot. And these are our the people that have been kind of supporting us along the way. Family Caregiver Navigator is largely almost all supported by the Money Follows the Person grant to the Centers for Medicare and Medicaid Services. And we have many partners that have supported us as well. So we'll go ahead and flash back to that other slide. And I'm just seeing some questions pop up. Yeah, and any other questions we can answer, anything we can be helpful with? I wish that we could just clone Adrian and give him to all 50 of your states because he is tremendous. I wish Adrian has 50 more brothers because people like Adrian are really leading the way, you know, in places like this, but it's taking all of us to really get the work done. So just want to appreciate Adrian's work. He's shouldered a lot of this work and we appreciate it.
Thank you very much. This is a wonderful presentation. I think as we look at the leadership role that you guys have taken in saying this is the problem and we're going to address it, and here's the first steps that we do, this is the beginning place, is really, really helpful as we look at this national strategy with all the recommendations that are in that and say, how do we even bite this off? What piece can we even chew? And that there is a beginning place, it's, you know, that you just say, okay, here's the need. We need this is the right move and we're going to take this on. So it was an amazing story and I really appreciate you sharing it. Is there anyone that has any questions for this group before we get to our wrap up here? Don't see any, but the slides will have all the resources and stuff that when this meeting minutes and everything go out, we'll make sure that those slides are included in the resources that you've mentioned to go and look at, because we like learning from each other. We have a very strong bring it, brag about it, and borrow it philosophy amongst our national network. So thank you so much for spending some time with us today.